1185 is referencing an issue that we've worked on for many years, auxiliary grants, and never really succeeded in fixing. And it was brought to my attention in the process of working in my community on COVID that COVID had provided some really unique crisis situations for auxiliary grant ALFs, or assisted living facilities, and particularly one not immediately in my district, but very close by, that has over 50% of their residents receiving the low reimbursement that we give for auxiliary grants. And it came to my attention that when you have centers, and there are several across the state of Virginia, that have 50% or more of these auxiliary grants, they're really doing God's work. This is really a charity, because what we reimburse for assisted living grants is around $14.10, I believe, $14.20, and the actual cost is really much closer to $3,000. And if you look at the averages from Genworth, they will tell you that across the state of Virginia, the actual cost for assisted living, or the reimbursement that they pay in the private sector, is anywhere from $3,600 to $6,000 a month. So we are leaving these centers who are taking care of our most needy elderly in an incredible deficit. And that was very much intensified during the process of COVID, when access to food was lost as well. And I have this particular ALF that's going to speak today and let you know a little bit about what they went through. So recognizing we could not move forward necessarily funding everybody more, I thought maybe the state should set a priority for those assisted living facilities that are doing this work for more than 50% of their residents, or essentially charities that are taking care of our elderly in Virginia. So, Madam Chairman, that's why this bill is composed this way. It makes up about 20 to 25% of our total assisted living facilities. That many of our assisted living facilities are doing this work with low reimbursement.